over the spinous process. Okay? So our hand contact is going to be over the spinous process. Now, depending on who you talk to, that hand contact may be a finger, maybe a thumb. I'm going to suggest that we use the area just distal to the pisiform, so right here. What's nice about this is it's a broad contact area, so it doesn't hurt you, it doesn't hurt them, right? So the key here is we have one hand that contacts and one hand that mobilizes. So my hand that's contacting is not pushing. My hand that's contacting is simply contacting. It has one job, and that's to find the right spot. Once it's there, it stays there. The other hand is going to do all the work. Okay? So one hand contacts, one hand actually elicits the force. And with central pavums, we're going to do this right over the spinous process. Now there's not a lot of soft tissue over here, so as patients are experiencing pain, we want to make sure that it's not pain from the pressure, but that it's pain that's elicited from motion of the segment. So you always want to make that delineation. If you're causing them pain, a lot of times I'll use Moog foam. Right? So Moog foam is really nice, works really well. During assessment, it's usually best not to use it because sometimes it gets in the way with perceiving motion. Okay? But as you're mobilizing and actually doing the treatment, what's nice about this, the exam becomes the treatment. So if I find that I have an issue that's hypomobile, if I find I'm eliciting symptoms, and I'm identifying some of those things, this examination technique moves right into mobilization. So this is actually the first spinal mobilization that we'll be doing. We're going to come back to it, but it's examination at this phase, but it's exactly the same as the intervention. Okay? So I'm identifying where I am landmark-wise, right, depending on where you want to be. I'm taking the area just distal to the pisiform, and I'm making contact on that spinous process. Okay? The hand placement here is what I like to call jockey on the horse. Right? So here's the jockey, right? And here's the horse. So the jockey is the mobilizing hand, and the horse, he's on the horse, and the horse is the contact hand. So I make the contact with the horse, and then I have the jockey over that hand. Okay? Now you want the patient close to you. Again, you don't want to see any green here. So go ahead and slide toward me. So they're as close as you can be. And what I tell people is you want them so close that as you lean on over them, if you had a bad case of bronchitis, your nose would be dripping right on the spot you're mobilizing. Right? You're going to drip right on that spot. So you're right here. You're not doing mobilization like this, right? You are literally right over the spot that you're mobilizing. Okay? So I identify distal pisiform. I have the jockey on top of the horse. The way that I'm standing is I'm in the straddle stance. So one foot is in front of the other, and I'm kind of leaning into the table. I'm kind of leaning like this. So there's no weight on this foot at all, this back foot. Everything's on the front foot. Okay? And I'm just kind of leaning into the table. And my nose is right over my hand. Okay, jockey on the horse, just like this. Okay, and then I'm just going to basically take up the slack. Okay, now the key is, what I often tell people, it's kind of like when you're about to water ski, and the toe and the rope kind of takes up, the slack takes up in that rope, and then you go. That's what you want to do here. You're not on the top doing CPR like this, right? You're eliciting force until you feel pressure, and it's at that point that you begin to apply that force. All right, so I'm on that spot. I kind of take up the slack, and then once I feel that pressure, I feel that resistance, that's when I begin to kind of think about my grades of mobilization. So think about grades 1, grades 2, kind of go through the gamut of the grades, and we're oscillating. We're going through an oscillation. If I see you across the room doing this mob, it's likely that you're oscillating too much. It's very, very subtle. So it's not like this, right? My whole body's not moving. It's literally, like this. A grade 1, Maitland says, a grade 1 is almost if you imagine a little fly on their spine and you're trying to bend his knees. That's a grade 1, okay? So we're talking small joints, small motion, right? We're not mobilizing the hip, okay? So hand contact that area, and then just gently apply with this hand is applying force through this hand, okay? That is central pavums.